How close are America's hospitals to buckling under the strain of treating coronavirus? The president of the American Hospital Association describes this pandemic as a once-in-a-century event. He is urging Congress to provide $100 billion in emergency funding to ease shortages at medical facilities. In hard-hit areas, testing resources are too scarce to screen anyone for the virus except healthcare workers and hospital patients. Some say they fear that doctors could soon have to make some tough choices, much like what we're seeing in Italy right now. Joining us now is Sheetal Sheth, who is battling breast cancer, and Dr. Lippy Roy, an internal medicine physician and an MSNBC medical contributor. Glad to have you both with us. Sheetal, let me start with you. How you feeling? How you doing?
I'm okay. I'm as well as we all can be at this time, right?
I hear that. I hear that for sure. How has this affected your treatment in terms of just having to go into the hospital, continue your breast cancer treatment with a compromised immune system, and then knowing what all is going on around you?
Well, I think for anyone who's in the cancer community, we all are feeling the same in that we're scared because we're having to decide what's worse for us, coronavirus or the cancer. And so every time we go into the hospital, as you mentioned, we're immunocompromised and we're possibly being exposed. And so we have to make decisions on what we're going to compromise.
I think Sheetal's feed might have just frozen up on us just a bit. We'll clean that up in a second. And let me come to Dr. Roy first and ask you to clarify for us not just what patients like Sheetal are dealing with, but what any number of patients who are immunocompromised might be dealing with during this pandemic.
So first of all, I'm sending positive thoughts to Sheetal and patients with cancer and obviously any type of illness. So cancer is not one disease; it's actually multiple diseases. And but right now we're kind of following the guidelines that have been set forth by ASCO. That's the American Society of Clinical Oncology. So I would recommend anybody with cancer or a family member who has cancer to check those guidelines. But right now, I think the main primary advice would be for anybody with cancer to really speak to their specific oncologist and their care team for specific recommendations and guidelines, because treatments, chemotherapy, immunosuppressive therapy, they all vary depending on the type of cancer.
Sheetal, I think we have you back. Can you hear me?
I can.
Okay, good. This is one of the weird things, by the way, about doing this is that Dr. Roy is like right there, and I'm looking this way as though we're not in the same room. So now I can look at you directly, and I can look at you directly, Sheetal. This is much, much better. Talk about what some of the precautions we're taking, the impact it's having on you, social distancing and constant hand washing and all of that. Is that helping? Is it not helping? Sheetal, what's your experience been?
I mean, we're doing that anyway because we're immunocompromised, so it's something that we do on a regular basis. I think that the larger things that we're seeing is that obviously we can't take support in with us. We're not able to take visitors in with us. We're not able to take, quote, unnecessary risks. So even our treatments and our exams, we're trying to decide, quote, what's an unnecessary risk with our doctors. And so I think the hardest part for us is that we know that in some way we are compromising the protocol that has been set for our treatment. And that's something we're going to have to live with.
And Dr. Roy, there's certain procedures that are already being put off, elective non-life-saving procedures. That's got to get dicey, even when you're dealing with cancer patients, maybe depending on what stage of cancer they're in, whether they're dealing with metastatic cancer. Like, it feels like just so many tough choices.
Tough choices is an understatement. And yeah, exactly. Look, all of this is suboptimal, Joshua. None of this is ideal. We're doing things that no doctor or healthcare professional would do in any type of ideal circumstance, but we are far from ideal circumstances. So yes, we still are standing by the recommendation. In fact, almost, I think, instruction to hold off on elective procedures, no matter what the field, oncology, cardiology, doesn't matter right now, because we have to preserve the protective equipment so that the doctors and healthcare professionals who need it in the face of this viral epidemic have it available.
Last few seconds, Sheetal, anything that you would like for doctors around the country to know about people like you going through this kind of situation before we go?
Well, I mean, we're so grateful that actually the doctors and nurses keep showing up, because I can't even imagine what they're dealing with. They're at the front lines. And I'll tell you, I just heard from a friend of mine who's going through treatment, whose nurse didn't even have a mask, and they didn't have enough. And they're all sharing masks, even though they're supposed to be single use. And they're still administering treatment. And it's a no-win situation for anyone in that situation. And so we're grateful. We're all in it together, trying to do the best we can. But it's all kind of which is worse, we don't know.
Yeah. Sheetal Sheth, strength to you. All the best to you in your treatment regimen. And Dr. Lippy Roy, good to be sitting right next to you and to hearing from you. Thanks very much for making time for us.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.